Hello, and welcome to the second module with information that will guide our reopening. In the previous module, we talked about 4 of our 6 pillars: culture of community, social distancing, hygiene, and face masks. Please make sure you have completed that module before starting this one. In this module, we turn our attention to the remaining 2 pillars: self-monitoring and testing. These activities are much more individualized, but they are embedded in our overarching pillar of culture of community. These are things that you do for yourself, but that protect everyone around you. So what specifically are we going to cover in this module? We will start by walking through what the onset of COVID-19 feels like and how it can progress. Then we will talk about screening and then testing. Along the way, we aim to answer some key questions such as, what do I do if I have an exposure to someone with COVID-19? What do I do if I feel unwell? What do I do if I test positive? Let's start with reviewing the typical clinical course of a person who has COVID-19, and then let's talk about when a person is contagious to others. As you're no doubt aware, people present with a variety of symptoms. The average incubation time is about 5 days. That means on average about 5 days, but anywhere between 3 and 14 days after exposure, an individual develops any or all of these symptoms: fever, dry cough, myalgias or body aches, sore throat, and the most specific to COVID, sustained loss of smell and or taste. Some people also, or instead of, develop vomiting and diarrhea. It's important to note that not everyone who becomes symptomatic develops all of these problems. Not even fever is seen in everyone. In many cases, these symptoms linger for about a week, at which point the individual either begins to feel better and gets well within a 7 to 10 day time frame after the onset of symptoms. Others continue to feel crummy, their symptoms plateau, and they recover in another week or so. About 20% of people develop noticeable difficulty breathing, which is called dyspnea. Although this can happen to anyone, this is more likely to include people in high-risk groups such as those with diabetes, hypertension, heart disease, cancer, or obesity. Depending on the severity of dyspnea, these folks may be treated at home with careful monitoring, or they may require hospitalization. What is the outcome for most hospitalized patients? It is super important to emphasize that the majority don't get transferred to the ICU and after several days are released to home care. The patients we have all been hearing about are those who do have to go to the ICU. Our ability to help such patients has improved dramatically since the beginning of the pandemic, but sadly, some patients never recover. It is important to note, however, that many people, somewhere between 25 and 40% of all people exposed to the virus, remain completely asymptomatic. This means they have the virus, they can spread the virus, but they never realize that they are infected. So when during this progression is a person contagious? Regardless of the specific suite of symptoms the individual has, they are shedding virus into the environment 2 to 3 days before symptoms appear and for at least a week afterwards. From a public health point of view, it would be much better if only sick people were contagious. Unfortunately, that's not the case with COVID. So what about those who never develop symptoms? If someone never develops symptoms, we cannot say for sure when they are contagious, but we assume it's within this 2 to 14 day window after exposure. As we have discussed in the last module, the fact that people can transmit virus when they don't know they have it drives the necessity to wear masks, wash hands, and maintain social distancing. Now that we've walked through the clinical presentation of COVID and its transmission, let's look at screening. The point of screening is to catch people in the earliest days of a COVID-19 infection, when the individual is producing or shedding virus, but still feels well enough to be carrying on with normal activities. Everyone who comes into our building for work or school, so staff, faculty, and students, will have to complete a screening survey before coming on campus. The screening survey is found on the landing page when you log into the Hofstra portal and has this red icon. Before we look at where it takes us, let's take a minute to talk about privacy. The results of the survey are sent to HR if you are an employee and to student health if you are a student. HR and student health are responsible for working with the Nassau County Department of Public Health to follow up on any potentially infected individuals. Let's take a look at these questions. You can see that they list the symptoms we discussed on the previous slide: cough, shortness of breath, difficulty breathing, chills, muscle pain, sore throat, new loss of taste or smell. Recall that these are the symptoms people experience when they first begin to feel ill. So if you answer yes to any of these, you absolutely must stay home. Let me repeat this: you must stay home. Should you turn out to be COVID positive and you come and expose other people, you will be responsible for putting many people into quarantine. Please don't be that person. But oh no, what if you have a fever? Obviously, stay home. At the present time, the School of Medicine does not plan to screen everyone entering the building for fever. We have a couple of reasons for this. First and foremost, it's just not effective. The people we're trying to screen out, asymptomatic folks, well, they don't have symptoms like fever. Second, fever does not typically occur without other signs of infection. So if you have a fever, you're almost guaranteed to have one of those other signs like chills or muscle pain. I don't know about you, but when I have a fever, I really don't feel so great. Lastly, the process of having to screen people as they enter the building will result in a bottleneck of people who are standing, hopefully in a socially distanced line, which is probably okay if it's a nice day and you don't have to get to class on time. But if it's not a nice day and you do have to get to class on time, not a great thing. So all told, it has been determined that screening for fever is simply not worth the disruption that it would create. Notice the last question asks about traveling outside of New York in the last 2 weeks. If you answer yes, you will be asked where. Then the outcome will depend on what the current COVID-19 prevalence is in the place you traveled. To find out about travel restrictions, go to the New York State COVID-19 resource page. Now, what about this question? Have you knowingly had contact or proximate contact with someone in the past 14 days who has tested positive for COVID-19 or has had symptoms of COVID-19? Exposure can sometimes be tricky to understand, so let's run through the following scenario. Here we have Tegan and Misha. They are in contact for greater than 10 minutes at a distance of less than 6 feet. Let's say they're in an in-person meeting or in the same Pearls group. They're wearing their masks and trying to keep socially distanced, but they do wind up being less than 6 feet apart for at least 10 minutes. Later on, Tegan has an event with Emma. Let's say another in-person meeting or class in which she is in similar contact. Turns out, 1 to 3 days later, Emma feels ill and has a COVID test. So 2 days after that, she discovers she is COVID positive. So Misha is obviously going to stay home and focus on getting well. Tegan, meantime, has had what we call a primary exposure. On the other hand, Emma has had a secondary exposure. Hofstra or Student Health, in conjunction with the Nassau County Department of Public Health, will launch contact tracing and let Tegan know that she had a primary exposure, meaning that Tegan was in contact, defined as that less than 6 feet for greater than 10 minutes, who developed COVID 1 to 3 days later. Tegan therefore has to quarantine for 14 days. Now, if she gets a COVID test that's positive, she can quarantine for just 10 days after the time of collection. If the test is negative, however, she's not off the hook. She's still stuck at home for the full 14 days. While all this drama is going on with Tegan and Misha, Emma finds out through the grapevine that Tegan is in quarantine. Emma is concerned, but she needn't be. She had a secondary exposure, meaning that she had contact with someone who had direct exposure to someone with COVID, but did not have direct contact herself. So no need to quarantine. When she met with Tegan, Tegan was not infectious. What specifically, however, should you do if you answer yes to any of those questions on the screening tool, including the one about exposure, now that we understand what that means? Let's start with what to do if you answer yes to having had a primary exposure. First off, you will stay home and quarantine. Isolate yourself from your household members. When in quarantine, you need to use a separate bedroom and a separate bathroom. Set aside dishes and silverware just for your use. Stay in one room. If you need to quarantine More specific instructions can be provided at that time. If you're faculty or staff, please report your absence as you normally would. If you're a student, you will report your absence to Student Affairs, again, as you normally would. As long as you are asymptomatic, you are expected to work from home, or if you're a student, you're expected to continue to participate virtually in all curricular activities except those that require in-person attendance, such as PD and structure. You will be provided with makeup activities when you return, and you can return if you remain asymptomatic. You can return in 14 days. Okay, now let's say you answer yes to one of those symptom questions. You must stay home and contact your healthcare provider. Stay home regardless of whatever pressing matters there are at work or school. And as with any absence, you're going to contact the appropriate people to let them know you'll be out. Your healthcare provider will decide if you should be tested for COVID-19. If the test is negative, you will resume your normal activities as soon as you feel well enough. Remember, people still get sick with diseases other than COVID. If your test is positive, you will stay home and isolate yourself. It's also really important to stay in touch with your healthcare provider so that your progress can be monitored. If all goes well, as it does for the majority of infected people, you will be able to return to work or school as early as 10 days after the onset of symptoms if you feel well enough at this time. All people who are home with COVID-19 or COVID-19-like symptoms will need to be cleared by their healthcare provider prior to returning for work or school. Lastly, if you are home in quarantine and you develop symptoms, please be sure to contact your healthcare provider immediately. Please keep in mind that all of these guidelines follow the CDC and the New York State recommendations and are designed to keep our community safe. Please also know that guidelines will change over time. We will adhere to the most updated guidelines available. Now that you know what to do if you test positive for COVID-19, let's talk about those tests. Briefly, we can categorize all tests into having one of two purposes. Diagnostic tests detect pieces of COVID virus, so this answers the question, am I currently infected? As of today, this is being done only with nasal swab testing, which detects viral genetic material, RNA, using a PCR technique. But hopefully this fall, antigen testing will be available. Antigen testing detects a piece of viral protein and would be easier to perform, something similar to a quick strep test. The other reason testing is done is to find out if somebody had COVID-19. This evidence is in the form of antibodies. Antibody testing answers the question, was I infected? This graph shows the timeline for detection. Notice that the x-axis is in days after onset of symptoms, not days after exposure. The y-axis is not labeled, but represents relative amounts of either virus or antibody. The shoulder on the negative side of the timeline is when people are shedding asymptomatically, as we have discussed. Notice that the maximum amount of virus present is shortly after symptoms begin. This is why, if you aren't feeling great, you need to stay home, even if in the pre-COVID era you would have soldiered on and come to work or school. Remember, you don't want to be responsible for sending others into quarantine. In contrast to RNA testing, antibody testing is most accurate after about 20 days following the onset of symptoms. Antibody levels decline but tend to stick around, well, in this case, we don't know for sure, but probably at least for months. So let's take a look at these tests.